Right. Yep. So good evening, everybody. Thanks very much for making the time to come along tonight. I'm sure you've all had busy days. We're going to be talking this evening about professionalism online. Um, Reem is helping me, so if you have got a question, do pop it in the chat or raise your hand, and we will, we'll endeavour to get to those as we go. I did give a workshop at your annual conference earlier in the year. So hello again, if I met some of the doctors on the call at that event. Um, at that event, we were talking about I think we were talking about professional behaviours, and this is kind of a continuation of that actually, because we're talking about professionalism online. So I've been with the GMC since January 2022. Before joining GMC, I worked for Cancer Research UK in their early diagnosis team, primarily working with GPs in primary care, if we've got any GPs on the call. And before that, I was at Asthma UK for a couple of years. And in a former life, I was a journalist on Pulse, the newspaper for GPs. So I suppose in a way, talking about professionalism online and particularly social media, it's a bit of a sign of the times, because when I first started on local newspapers and on Pulse, we had a weekly deadline. In some ways, that was quite stressful because you had to get everything, you really had to put a story to bed once a week. And now, it's much different in journalism. You go to conferences, you have to, post online from the conference, tweet, put updates on Facebook and everything. So just in journalism, times have changed. And obviously with, with the pandemic, I think that's really moved us forward in the use of online, both with patients and professionally. So they have been, it has been an interesting time to work in both health and journalism. I'm part of the GMC outreach team. Our role is to work with groups of doctors through delivering workshops, both online and in person. I would say probably getting a little bit de-skilled online, because we did, we've really gone back to doing a lot of events face to face, but it's good to do events online and, meet different people from different locations, because it's not always practical to get everybody together. Also within my team are, so my role is the regional liaison advisor. We're a nationwide team. We cover all of the UK. But also within our team, we have employment liaison advisors whose role is to kind of sense check with employers if they want to make a referral concerning the doctor to the GMC. The employment liaison advisor will be a kind of sense check that that's appropriate, to kind of ask, what kind of local things have been done with the doctor already, what interventions, etc., what feedback might have been given to the doctor, about, the concerns that they have. So there's two parts of us. I work on with groups, and my colleagues who do the employment liaison advisor role, they work with, regarding individual doctors and employers. The GMC, I think, is most well known for its fitness to practice procedures. We make the referrals to the Medical Protection Tribunal Service, and we do the initial investigation, but the Medical Protection Tribunal Service, Practitioners Tribunal Service rather, is an independent organisation. So once it's gone into there, it's kind of down to the tribunal hearing, what the outcome is, etc. Just to reassure, because I think there is quite a lot of fear about the GMC at the moment, we do have very few referrals coming to us about professionalism online or social media. Sometimes it can be something, it can be something else as part of like the bigger case. In terms of, how many doctors have the ultimate sanction from the GMC of erasure or suspension, we look after 350,000 doctors on our list, so that's the register that we maintain. And we have about 50 doctors a year that result in a sanction being given by the tribunal service. So it is a very small number. And in terms of clinical competence, the numbers are really small. A much bigger factor is honesty and probity, where it's, we don't expect mistakes not to happen in medicine, but where they do happen, we expect doctors to be open and honest, etc., and to show insight and learning, when mistakes do happen. So as well as looking after the register, as well as fitness to practice, we also oversee the education standards, both of UK medical schools. We do all the quality assurance for those, but also for international schools to reassure ourselves that international schools' primary medical qualifications are comparable to the UK ones. And that's quite interesting at the moment, because we are a much more international health service, not just in the UK, but we know that a particular trend at the moment is some UK students going abroad, UK born citizens going abroad and doing their medical qualification at other schools. So it's quite, it is quite interesting how we have to kind of link in with those international medical schools as well. And then finally, we also oversee revalidation, and we do actually do another workshop on that and reflective learning. I'll just put that out there if that's of interest for the SJDA in future. So I just wanted to kind of take stock before we get into talking about social media and online, that we are in a unique place at the moment. We've come out of COVID, and the NHS, we've obviously got the doctor strikes as well, and it is a difficult time. This is a monument, a memorial outside BMA House to honour the doctors who gave the ultimate sacrifice during COVID, and sadly lost their lives. But I share this image as a kind of reminder really of where we are, and recognizing that these are not easy times. And having come to your annual conference early this year, I know for Sudanese doctors it can be it is a challenging time at the moment because of what's happening in your home, your place of qualification. So we do recognize that, and I just wanted to acknowledge that this evening and kind of take stock. So we have come through the pandemic. Doctors do remain one of the most trusted professions in the UK. And I think, when we look at our standards that we hold doctors to, I think this is really significant because, as I said, we did roll out the vaccine very quickly. We did, we talk about being in a post-truth era, don't we? But doctors have maintained that position. 2021, you were overtaken by nurses, by librarians, sorry. Nurses are always top. I think last year, 2022, were overtaken by engineers. Does anyone want to have a guess what the least trusted professions are? I'm going to come off mute or use the chat. I can see the chat actually.
Lawyers?
Lawyers, yeah. I'm not sure if they're in this one actually. Yeah, keep them coming. I mean, lawyers are regulated, but any other suggestions? And you can use the chat as well if you wish. Okay.
It's the Sudanese. They bring someone from GMC.
So these are the, as we can see, these are the
least trusted professions. Business leaders, journalists, government ministers, politicians generally, advertising executives,
Yeah.
the least trusted.
I would never believe a journalist or a lawyer. Lawyer should be on the top list.
Yes, because lawyers will just work for the money.
You know that
They
one
will
of our
defend
leader,
whoever.
Iqbal.
Sorry.
So yeah, so we have got yeah, quite, you know, as I say, this kind of makes the point that it is the unregulated profession. So do come off mute. I did just mute someone. I kind of think I think I picked up you having a conversation with someone else, but if you want to join in the conversation, please do unmute yourselves and come into that. And we've got someone in the chat. Oh, Shadeen. Don't worry, Shadeen, it's fine. So yeah, okay. So that's, you know, I think that is testament to the standards that we hold doctors to account to in the UK. We talk at the GMC about trusting you and trusting the profession. And as I said, that is something that we do take very seriously at the GMC. Why would you say that is, that we have, you know, we place such emphasis on that, do you think?
Just to avoid undermining the relationship with the patients, because they trust us with everything.
They do, don't they? And I think, you know, if you've ever been a patient yourself, you know how much you are, you know, you feel quite vulnerable, and you are, you know, really at the mercy of those who care for you. You do put an enormous amount of trust in them. It's also about patience. You know, I know that I can go and see my GP. I can be absolutely open and honest, you know, about anything that I've been doing or haven't been doing, you know, the last week, and it's between me and the doctor. And for you to make those holistic, insightful clinical decisions, you really do need as much information as you can get from patients. So we do, you know, confidentiality, which is an area that does come up with social media being breached, is something that, you know, we do hold very in great, you know, with great importance. So confidentiality, being able to you know, really have that trust in your doctor, and being able to share exactly what's going on, and be reassured that you know, information isn't going to be shared outside. And again, we do, you know, we place a lot of importance on that. I think sometimes, you know, when we are dealing with colleagues or dealing with patients, we sometimes feel, you know, that putting things into emails or into, you know, texts or messages can actually be a better way, or a clearer way perhaps, of getting across, you know, what our point is. And obviously for some things, you know, like medicine instructions, etc., yes, it can be. But I think sometimes for those kind of more delicate conversations, particularly if it is dealing with colleagues, it's much better to pick up the phone. If I'm writing an email to a colleague and I'm, you know, drafting it 2 or 3 times, I will, you know, I've learned to just sort of stop that and pick up the phone and just have a conversation with someone. So there's a great organisation called Civility Saves Lives, and what they say is, you know, it's much, using the phone is much better. My screen's not started moving. Sorry about this. So, you know, do think about, you know, when you are dealing with colleagues, or particularly work colleagues, you know, I think sometimes we you know, we can become reliant, can't we, on emails, you know, just because they're there and easy ways to communicate with everyone. But actually sometimes, you know, picking up the phone is a much easier, it's a much better way of getting your point across. I think with emails and with text messages, sometimes we don't understand the tone of what people are saying, and we sometimes read things how we would, you know, read them, how we would understand them. So, it can sometimes create conflict in terms of what, sharing things electronically. So as I say, if it is something delicate or you want to give, some feedback to a colleague or whatever, I would strongly recommend, considering picking up the phone to make it a much more meaningful conversation. I'm doing some volunteer work at the moment, and they seem to be using a WhatsApp group for kind of exchanges, and it's really difficult sometimes to kind of see that people are trying to be constructive, and you can see it coming across the other person as slightly hitting a wrong note with them. So do have a thought for that. When I said at the beginning, my name is, that is actually, you've probably got it around your lanyards if you're in training. Hello, my name is, and that was a really powerful online campaign. So the GMC is not, saying this evening, don't use social media. It can be a real force for good. I think, it's been an absolute game changer that, when I first started as a journalist, if you wanted to look something up in the British National Formulary, you had to kind of, dust out the copy that was in the office and find it. And, things like that are online now. Clinical guidelines are online now. So in some ways, it has been a real help. And, for your own personal development and learning, it's been a game changer, things that you can complete online. We also have some, fantastic medics who, have used that influence online. These are kind of the beautiful people, if you like, who use it to promote healthy living, etc. I don't know the others. I have listened to Dr. Chatterjee's podcast. His is really nice, actually, for reflecting on kind of quality of life. But I'll give you another example. During lockdown, there were some Muslim GPs in Bradford, and they use social media to really connect with community groups to overcome the barriers that there were about the immunisation programme. So, it can be a real, power for good online. And although there are kind of pitfalls to avoid, I hope that doesn't sort of put you off using it. Most mistakes that happen online are inadvertent, so people kind of commit them and perhaps don't realise. This was quite a while ago. We know Jeremy Hunt now as our treasurer, chancellor rather, but in 2015 he was the health secretary, and he did go to visit a London surgery unit, and where the board is with the yellow arrow, it's been blurred out now, but that was a patient list with the patient names and the operations they were due to have that day, and that did get tweeted, and it did get picked up. It's the Independent newspaper ran a story about it. So it just sort of shows the example that, it's a good intention, give a bit of recognition to the staff, but actually, there was an inadvertent patient breach there. So, it just sort of demonstrates that point, really. In terms of how we define social media, it's not just, posting on social, Facebook, Twitter. It could be things like WhatsApp, doctor communities, doctors.net, I know is very popular with doctors, Facebook, LinkedIn. So we describe it as any terms that result, allow people to create and exchange content. And I dare say, if I come back in a few years and repeat this session, I'll be talking about different web-based applications there too. So what questions do you have about social media? What do you think are the challenges with using social media? Would anyone like to put a note in the chat or come off mute? That'd be really helpful.
Fatima, you've got your hands up.
Hi, Fatima.
Yeah, hi. I mean, the third thing which came to my mind is maybe just being always cautious about, breaching patients' confidentiality in the social media. I mean, I think this is one of the most important things.
Breaching confidentiality. I think, as the example with Jeremy Hunt shows, it's really fast. Social media. I think the other challenge for doctors is it can make you really accessible. So I don't know if anyone on the call has, been contacted by a patient yet who's found your, your website or you. Or your, as kind of private message you, but we do hear of that happening to doctors. We've got something in the chat. We've got a comment saying this is from Dr. Osman El Hassan. Possibly not doctors not understanding what actions are considered to be a breach of confidentiality. Yeah, we'll talk a bit about that in a moment with one of the case studies. So do hold that thought. So. The kind of challenges that we, have come up with are confidentiality, bad language, discriminatory language. So, we know that in all industries, not just medicine, people's behaviour does decline online, whether it's because we're not picking up the body language cues or as I said before, it's difficult to kind of get across, the tone that we're saying something in. But I'll give you an example. Where I live, we've got a beautiful bluebell field. And, every year, people get quite anxious about people walking on the bluebells because they take 8 years to grow back. So there's a lot of sort of nature that goes behind creating this beautiful field of blue, and on the local Facebook pages it sort of starts with people saying, oh, we should put up signs, etc. And then by sort of tweet number 4 or post number 4, people are saying what really horrible things about the people who walk on the bluebells, and the air has kind of turned blue because of what people are saying. So again, just I think perhaps because we can feel that we're not sort of saying things to people's face, we can sort of feel a bit protected by that. Depictions of intoxication, I'm going to talk about that. I think even though I think perhaps a better way of saying that is perhaps about the different prisms that people can perhaps take some of the things that we're posting online, and we're talking here about things that are publicly accessible. So if I put your name into Google, what I would find, what I would see come up, and actually that's quite a good test to do, just to see what comes up if you do put your own name into Google. As I said, it does make you more accessible, so you can, have inappropriate contact with patients. And when we talk about inappropriate prescribing, it can not just be prescribing, but, if you're a parent and you found yourself on kind of WhatsApp groups, etc., sometimes parents will kind of say, ask questions, and particularly if they know that you're a doctor, might ask questions about, their child's asthma or rashes or things like that. And it's much safer and better for you if you, wherever possible, unless it's like a real emergency, you can direct people to go and see their own doctor, and that's what the good medical practice guidance says you should do. Okay, I've got a thumbs up there in the chat. So okay, let's move on. As I said, social media can be really fast, so there could be a Snapchat, which you think is a private exchange. Someone takes a photo of it, posts it on a WhatsApp message. It gets circulated. Twitter is not necessarily about the numbers, but it's where the real influencers are. And Facebook is, where you've really kind of, hit the big time and kind of reached the numbers. And all of that can happen in about, 2.5 hours. So it can be a really quick, we live in a very fast information time. In terms of what GMC says about the use of social media, we do have good medical practice. And we do have a much shorter explanatory guide, which is only a couple of pages long, which you can download from our website. The reason it's so short is because really the bulk of what we expect of doctors online is the same as what we expect of doctors in, when they're seeing patients or the public face-to-face. We expect doctors to maintain those same standards. So they don't change because you are communicating through social media rather than face-to-face. We know social media sites can't guarantee confidentiality. And unfortunately, that is something you do have to bear in mind, even if you are using platforms that kind of claim to protect that. Sometimes people think they can say they're a doctor in public, but do so in an anonymous way. So, they think it's okay if they say that they're a doctor, but don't give their name. And actually that is breaching our guidance. It clearly says if you identify yourself as a doctor in publicly accessible social media, you should also identify yourself by name. And that's because, any material written by authors representing themselves as doctors is likely to be taken on trust and may reasonably be taken to represent the views of the profession more widely. So, as I said, our guidance, it is about, keeping those boundaries, upholding confidentiality and having that respect for others in the same way that you would when you're, dealing with your patients and colleagues every day. I think, sometimes the test is, a good test to apply is if you wouldn't go into the waiting room and say it, or you wouldn't say it face to face to a colleague, it's probably not okay to be putting it on social media. It's that's getting into sort of tricky territory. That's not to say that doctors can't have views. We have doctors who become MPs, but it's how you represent those views and the respect, particularly with people who might not share the same views as you, conducting yourself in a professional way that doesn't result in that trust in doctors that we talked about being so important at the beginning, of that being compromised. It doesn't take much for patients trusting doctors or trusting the system to be affected. So when I was at Cancer Research UK, which wasn't that long ago, January 2022, I was having conversations with some of the breast screening units that were taking calls from patients saying, I'll come in for my breast screening appointment, but can you do anything? Has the NHS got the resources? And unfortunately, because of the whole COVID stay at home, this kind of focus being on COVID patients, that's what some patients were thinking, which is quite an astonishing thought, isn't it? That someone might choose not to go for their breast screening because they think, there isn't the resources. So, we do have to bear in mind that equilibrium and the importance of keeping it. So I'm going to give you a case study now. We've got Sam. They're a doctor in training, and they ask a patient if they can take a photograph of the rash on the patient's ankle so they can show it to their consultant who's currently in a meeting. The consultant is in a meeting and they don't have access to their laptop. There isn't Wi-Fi there. So what they've actually asked Sam to do is to share it by WhatsApp. So what might be the problems or things to think about if, another colleague does ask you to share a picture in such a way? You can either use the chat or come off mute.
It might be sent to the wrong person if they're sending it through WhatsApp or so. Or maybe the consultant is not in a setting where he can see that privately. Maybe there's people very right next to him or standing behind him, etc., who can actually see that photo.
Yeah, I think that's a really, I think that's a really valid, those are really valid points. Anybody else? So you could preach, patient confidentiality that way, couldn't you? Anything else?
WhatsApp and other social media platforms are not really secure, so there is risk that that photo might end up elsewhere.
Yeah.
So there's no security there.
Yeah, definitely. And I think sometimes, particularly I think with some of the foundation doctors I work with, WhatsApp has been their real kind of friend through medical school. And now they're coming on, their first rotations. They're still using WhatsApp to kind of ask questions, amongst each other about patients. And I'm quite cautionary with them about that. I say, you may have to be the one who calls that out and says, actually, I think we need to take this conversation to a more secure domain, such as NHS Net, so you could do it through through that. If you do work in dermatology, sometimes they have very good cameras and very sophisticated ones that link into the patient's record, etc., and share it. So there might be a kind of trust protocol on what you should do, but it might be, this is a situation. We did have a situation in London a couple of years ago. I think it was Guy's, where the hardware did actually melt in the truss because it was a really hot summer. And so the doctors did start to use their mobile devices, and there is some guidance on that. So in this circumstance, it was the best way to get the consultant's opinion. I think, sorry, forgive me, I don't know who said it, but I think the point about where the consultant was going to look at it, that could be something you could ask. You could say, look, I've included this photo. Are you somewhere where you can open it in private? And the other thing you've got to be mindful of is if you share pictures, you need to not only delete it from your device, but you need to advise the person you sent it to delete it from their device. So WhatsApp, I don't know if it still does it, but it used to put that photo into your personal library. And then doctors have kind of opened it up to find a family photo, and there's been some quite personal photos in there of patients. So you do need to be mindful of that. I think there are other tools that you can use on instant messaging apps now, where the photo is kind of set up as one that you can you can only look at it once, and then it deletes it automatically, etc. If Sam was using a personal phone, it should have been secure. I think most phones nowadays are password protected, or even I think Face ID is a great way. And as we would if we were sharing any information about a patient, we can think about, do we need to tell the other person everything? Could we use initials? Could we say a man in his 50s rather than a 55-year-old man, etc.? So that kind of sharing information in a necessary way is something to think about. I'm told as well that there is an NHS approved app called Pando. I hear quite good things about it from doctors, but that might be another tool to think about if you are using instant messaging apps. You do need to get the patient's consent before sharing, and I think it's right that you should say to the patient, you're going to take this photo and how you're going to share it. I think if patients did find out, subsequently their photo had been shared via such a familiar app as WhatsApp, they could be upset about that. So you do need to get the patient's consent. Your trust might have their own policies, so your employer or even your GP surgery might have something as well. And the other thing as well is to think about, how you're going to record that information. So the NHS digital guidance does have some information on instant messaging. They do talk about a proportionate approach being needed. So, you need to balance the benefits and risks of instant messaging. And I think, the risk is when instant messaging has become the default, or has not become the default, rather has become the norm. I spoke to some doctors the other day, and they were some dermatologists, and they said they had a skin cancer WhatsApp group going, and I advised them that probably wasn't sensitive or private enough for patients. So they took that on board and said they were going to shut that down. Okay, let's have a quick look at the chat. Would you please write down the app? No, yeah, it's called Panda. Oh, thank you. Fatima's written it down. So yeah, do check out if that's available. You do also need to think about the patient records. So if you do use instant messaging, you still need to keep a comprehensive medical record. And as I say, there's some extracts from the NHS about that as well. I mentioned at the beginning, I think I talked about intoxication, but I'm conscious, not all of us drink in our lifestyle choices. But even sharing something on social media that your patients are going to see can create complications. Again, it's not something that will come to the attention of the GMC, but there was a case recently where there'd been a death of a child at a London hospital, and the named consultant for the child had gone to a conference that day and tweeted a photo of their very lovely setting that they were in, and I'm absolutely not saying it's not okay for doctors to go to international events, etc., but just making the point that it's another thing that a patient might see, and in that doctor-patient relationship could potentially make it difficult. And as I say, for this doctor, that was something that the parents of this child were upset about. During lockdown, we had doctors all doing the same dance to kind of let go of some stress. This wasn't a matter for the GMC either, but it was called out by a geriatrician who said, you know what, we've had to deny patients their operations today, their appointments, and I don't think it's a great look for patients to see doctors dancing online. Again, absolutely nothing wrong with doctors letting some stress go. People need to do that, but I think again in the publicly accessible domain, it can create complications with patients. I sometimes get asked, I don't know if we've got any aspiring surgeons on the call, but sometimes I think particularly in the US, on Twitter, you'll see a surgeon who's doing a pioneering technique, and it's all very raw and in the theatre and everything, and they've got a big banner up, shared with patients' consent. I mean, I can't really speak for the US, but I do get asked that by some British surgeons, what my thoughts are on that. And I think you can breach confidentiality if a patient gives consent. I guess my question mark is, if the purpose of it is sharing this, new operation for learning, is publicly accessible social media the best place to do it? Why not go to one of the medical journals or, to one of the doctors only forums to share that? Yes, you could say you've got patient consent, but I still think, that could be problematic because, if you are about to do this very kind of complicated technical pioneering technique, and you're asking for the patient consent, I guess there's something there about what's the balance? Is the patient saying yes because they don't want to upset their doctor, or they want to please their doctor? So my advice would be, if and we do have great things to talk about in UK medicine, is think about using your communications department. If you work at a trust, they would definitely have one. If you work in general practice, then your local provider, your local commissioning group or ICB, they will have a communications department, and I think that can just help to kind of bring some neutrality and some professionalism to what it is that you're wanting to share online, and it kind of it levels out the risk really, if there is any feedback about it subsequently. Another thing in the transferring of information is patients these days. I don't know if anyone's had this on the call. Please share if you have patients asking to record a consultation on their mobile phone. So again, this would come under you know, this will come under the professionalism online. The guidance that we have in decision making and consent is you should accommodate patients' wishes if they would like to record the discussion. I do emphasise that this is in decision making and consent. I don't know how you feel about that, but I do get, I certainly know when I speak to GPs that they've found it, they've become much more comfortable, I think, with being recorded. Certainly GP practices now record telephone calls. And I think some of the GPs quite like it, because when patients make a complaint subsequently, they can play back the recording of what the receptionist said, and you know, it can be quite helpful. But for decision making and consent, we do say that you should accommodate a patient's wishes if they would like to record the discussion. Okay, so let's say that you're on a placement and you've got a patient, they're a young patient, and they ask if they can take a selfie of you with them for their Instagram account. What are your thoughts about that? Would you be okay with that? Would you decline? What might you have to consider with this type of request?
I think I don't mind, but
Okay.
maybe we need to consider I mean, I don't know, maybe what sort of people are like involved in their Instagram group, etc. But I don't know, from my side, I don't think I mind. Maybe I would mind the recording of like a professional conversation. I don't. It hasn't happened to me, but I feel like I'd be a bit uncomfortable. And we always make time in our practice to speak to next of kin, family, or even have set these meetings where any family member the patient would like to attend, and we can have that discussion with everyone. But yeah, I wouldn't mind the picture for Instagram.
Okay. I mean, going back to the previous point about, you know, allowing a recording, I think, you know, I think it's important to establish why the patient, you know, wants to record you. And as I say, our guidance is that it is to inform their decision making and consent. You know, then you should allow them to do that. I think, you know, you could just, you know, politely point out, you know, yeah, that's fine to take a recording, but you know, it mustn't be shared, you know. And I think most patients would honour that and respect that. I think even with having relatives, you know, sometimes with difficult conversations in particular, you know, there can be a lot of information to process, etc. So it can be really helpful. I know some doctors, and they will establish with the patient, oh, you know, you want to record me, you know, can I just ask why? And the patient will say, you know, look, I won't remember everything that you say. And so the doctor will then say, well, look, you know, you can record me, or you can, you know, save your data. I'll explain what, you know, is going to happen, and then at the end I'll give you a quick synopsis of what we've discussed, and you can keep that to take home. So you know, you're giving the patient a choice there. But I don't know, I think it is the future. I think we are all being I'm being recorded tonight, and you know, I think it is something to get comfortable with. In terms of the taking of a photo, I think there are a few things to consider here. I think one is, you know, the privacy of other patients. I think something else to think about is where you are in the patient journey. So, you know, if it's at the end of the treatment and they're, you know, it's been a success and, you know, everything, then, you know, that would probably be more straightforward than, you know, if it was someone sort of, you know, doing a sort of online diary, if you like, of their health journey. And you know, you don't have to say yes. You could politely decline, just saying, you know, no, I'm sorry, you know, that's not our policy, etc. I think something else to bear in mind is particularly if you are, you know, working with a population that's quite young, you will be asked again for more Instagram account pictures. So you know, that's something to consider. Okay, so I'm just going to finish now with some cases that have either come to our attention, to the GMC's attention, or have, you know, resulted in the doctors, you know, having come to the attention of their employer. I've got someone's hand up. Amira Ibrahim, please. Did you want to ask a question?
Yeah, hi. I just had a question regarding the telephone calls that we can do from our home. Are we allowed to use our own phones?
I think as long as they've got their own privacy settings, I would think your employer would probably have something about, you know, the protection of patient numbers, etc. I can't think of any red flags at this point about using your own phone to make telephone calls, other than, you know, it needs to be a protected device. But what I'll do is I'll leave that one with me, and I will just kind of take that away and just see if there's any further points to consider about that, if that's okay. Was there something in particular with that you sort of had at your back of your mind, or?
I'm just thinking because, you know, we usually call, you know, sometimes we call from either from our mobile numbers or from the landline. So I'm not quite sure. I haven't done that before, but, you know, potentially we can do that. I'm just thinking whether the mobile phone will be protected or no.
Yeah, I mean, I think with modern phones, I mean, are you thinking someone kind of being able to listen into the call or something? Is that something?
I'm just thinking whether this could be like, you know, the social media is not protected, so it means that even the mobile phone, it might not be protected.
Yeah, I mean, I guess in terms of confidentiality breach, I mean, I guess that's always a risk, isn't it, with kind of social media, with any kind of technical device of being, you know, being hacked. I suppose that kind of makes the case, you know, for, if you, certainly with colleagues, you know, sharing information on a kind of need to know basis, rather than you know, if you do have to kind of use things like instant messaging. But I can't think of a reason why. I suppose you've got to think, you know, what's best for the patient. And I guess if we try to sort of mitigate, you know, that the phone could be hacked so we wouldn't use it, that's probably going to do, yeah, that would do more harm than good. But leave that with me, and I will I'll see if my colleagues have been asked that question before, and if, you know, if anything has kind of come up. But yeah, I can't immediately think of something. So yeah.
Thank you so much. Yeah.
Okay. So yeah, so this was a trainee GP, and they posted some, you know, patient, they didn't name the patients, but it was quite, you know, disrespectful, you know, very disrespectful kind of language around it. So I think this doctor did receive, I think it was a suspension for 1 month, and he was referred by the GMC to the Medical Practitioners Tribunal Service, and unfortunately for them also got some media attention because they were in the BMJ as a result of it. This was a much older consultant, and someone, you know, introduced him to social media and kind of said, oh, and they started, you know, they hadn't really taken on the kind of etiquette, if you like, about the patients who they were seeing. To be fair to the doctor, again, I think he was given a warning. I don't think he was given a suspension. I think with this doctor, he did show real insight and quickly recognised, you know, that they were, you know, that they were at fault and shouldn't have done this. So, but it was one that did come to our attention. This was a doctor, they'd gone to a music festival with some friends, and one of their friends had a small amount of marijuana on them. I don't think they were arrested, but they were searched. The friend was searched by police. And when the police looked at their WhatsApp group, there was some violent pornography on there. Now, the police didn't take further action legally, but they did refer the matter to the GMC. We didn't, we didn't refer it on to the MPTS or anything, but we did write a letter of advice to the doctor saying, just reminding them, of the kind of standards we expect of doctors, etc. So again, I think just bearing in mind of, the standards that doctors are held to, and how even when we think something, is private between us, between friends, in this case, it definitely wasn't. Another example was, this wasn't something that came to us, it was something that the trust intervened and asked the doctors. So the trust started internal disciplinary proceedings, and this was two doctors who had a conversation about a patient who died on Facebook. So again, it's that thing of thinking something is private, but actually, whoever had managed to see this, and as I say, it was brought to the attention of the trust, who intervened. This was, again, not something that came to us, but it was a call by a doctor made to the one of the medical protection societies for advice. They treated a trans patient, who'd been violently attacked on their way home from a night out. And the doctor was very upset about how this patient had been treated, and put a note up on social media saying, this is a sad reflection, we really, etc. And they called they called their defence union, because their education supervisor had got in touch and said, take that down immediately, and come and see me first thing in the morning. And they were confused, as they said, well, what have I done wrong? I haven't named the patient. And potentially, someone, can put two and two together, but that's less of the point. The point was that the patient themselves could have seen this. And so making kind of those contemporaneous tweets about patients, we have to be really careful about, because again, that trust in doctors that is so important. Again, I mentioned earlier, you are allowed to have views, but it is how you share those views. Again, this was to do with trans rights. There was a GP who become sort of specialist. I think he was running a specialist clinic, and he took to task some people who had views that were different to his about trans patients. Again, it wasn't the difference of views, but it was the language that the doctor used with these people. I think he called them, complete bigots, etc. And so that did come to the GMC's attention. There was a referral made, and they were suspended for 1 month because of the language that they'd used with people. To be fair to the doctor, they did accept that the ruling was fair and proportionate when they'd shown that insight and reflected on what they'd done. That was what they concluded. But and they did actually say, I'm still going to, fight for these rights, and it's still really important to me. But I think they learned, the lesson the hard way, that you do have to do it in a way that is respectful of other people. This was a doctor. He'd previously been seeing a patient, dating them, and then the patient turned up in the A&E where they worked. The doctor didn't see them, but the patient did get in touch with them and said, oh, I saw you, working in the A&E tonight. I was in there. And the doctor did proceed to go and get their medical results. They gave them some medical advice, and they arranged some medical appointments, all via WhatsApp. So this was all you know, I think again it kind of shows how you can have that accessibility and kind of boundary creep with online. And they did actually meet up as well. So we did take that very seriously, and the tribunal did give the doctor a 4-month suspension because of, you know, the boundaries that had been crossed here. But again, you know, I think the test to ask is, you know, for in those kind of situations, and it does happen, we do see people that we know come into, you know, places that we work, but, you know, would that doctor have walked into the imaging department and said, you know, can I have the imaging for that patient, you know, because they're my friend? Of course they wouldn't. Would they have gone, you know, they just wouldn't have done those things face to face, but, you know, because thumbs were being used, it felt safer to do so. If a patient does contact you through your private profile, it does happen. You do just need to say, you know, you can't mix social and professional relationships, and where appropriate, direct them to your professional profile. So that could be, you know, if you work in a GP practice, you could, you know, direct them there and say, you know, you can put in a query, you know, via the practice manager, etc. Or, you know, again, you know, your trust might have a bibliography of your of you that, again, you know, you could signpost patients to. But we do get some quite uncomfortable things sometimes happen for doctors. So whether you're a trainee doctor yourself, or, you know, in your career you supervise trainee doctors, we had quite a creepy case where there was a trainee GP. Patient asked them out on a date. They politely said, no, you know, absolutely not, I can't, you know, I'm not allowed to date patients. And the patient went away, found their Facebook profile, and then found out where they were going on holiday, and sent them a book about where they were going on holiday, found out their favorite flower all through their Facebook, and sent them a bunch of flowers. So it was just quite, you know, it's very unpleasant for that doctor to have to deal with. So doctors who I work with at the GMC, for their kind of their social media with friends and family, they use a different and a kind of a deliberate misspelling of their name, or, you know, they'll substitute an I with a exclamation mark, etc. So only people that they want to know, you know, that they want to see their pictures of holidays and kittens or whatever, have access to it. And, you know, again, I would recommend doing that as a bit of a test after tonight's call. Put your name in Google and see what comes up, just to kind of manage those boundaries. Ed Sheeran fell off his bike. Again, not a matter for the GMC, but it was something that was picked up by the trust. Ed Sheeran, the word got around the trust where they were where he'd been admitted, that Ed Sheeran was in hospital, and they had a line of patients around his bed, all of staff rather, around his bed, all wanting selfies. And really, you know, someone, if there was a doctor who saw that happen, they should have, you know, intervened and done the professional thing and said, you know, Mr. Sheeran is a patient today, and, you know, we need, as such, needs to be treated as such. So it was Ipswich Hospital, so they did open an investigation into that. This is quite interesting. What would you do if you received some negative feedback on social media? We've got Matt. Can we get any thoughts what you might do? Would you respond to this? Would you?
I think what I would avoid doing is respond to it using like my private profile, like my own social media profile. I think the tweeting at a GP surgery, I presume, so the surgeon might have their own professional profile that they could use to maybe reply politely saying, can you email us what is it that you're concerned about, etc., and we can look into it.
Yeah, that's an excellent answer. So yeah, I've only had one. So there, I mean, probably if you, from your personal account, absolutely right, it's probably best not to get drawn into it. But you could actually turn it, you know, you could actually say, ask if you have capacity, which you might not have at the moment, but, you know, the practice manager via the surgery account could, you know, contact Matt and say, look, you know, we understand you've had a negative experience today. Would you, you know, would you like to talk to us, or would you like us to look into it? But from your kind of professional profile, I think sometimes it's better not to get involved with that. Got someone in it. Yeah, Fatima said we'll ignore. Absolutely right. I think, you know, it's not something to be drawn in unless, as I say, you know, you might want to use it as an opportunity for the practice manager to get involved. Okay, we are getting close to the end. I hope tonight's been useful. There are quite a lot of resources out there. So there's NHS Employers has a social media toolkit. So I just wanted to leave with some kind of take-home points. So good medical practice does say make patient care your first concern. Social media is fast and makes you more accessible. In thinking about, you know, making patient care your first concern, although, you know, it can be appealing to promote things that we're doing online, etc. We do need to be really, really careful of that being the priority. So think about your boundaries, think about your respect and confidentiality, remain your professional and ethical self. So, you know, that doctor that's you on your daily, you know, working life, just keep that, keep those standards when you go online. Remember, posts can be seen by different prisms, by different people. That's not going to get you, you know, as I said, what we're talking about tonight isn't going to be something that's going to bring you to the attention of the GMC, but, you know, it just can become problematic with patients. And, you know, the example that I used about the doctor on their publicly accessible social media, putting where they were that day. We know that people's behaviour generally deteriorates online. I mentioned at the beginning, you know, sometimes it's much better to just have a face-to-face conversation or pick up the phone. And, you know, do be mindful how upset people can be if they see other people, you know, have kind of read negative feedback, etc. Apply GMC and other relevant guidance policy, and do think about your own personal and professional profiles. We are human. If you make a mistake or you're unsure what to do, take whatever it is that you've put up down, seek appropriate advice about what you should do, and make some notes on your reflections and actions, because, you know, that can subsequently help you. If you are a member of a medical defence union, they will have helplines that you can call. You're also, the GMC has a confidential helpline as well that you can call, and we will, you know, we can share advice and resources for you there. So that brings me to the end. You can have a certificate for attending tonight if you wish. You need to, it might be better to do it on your computer, because not many phones allow you to edit a PDF. So, but if you've got a clever phone, you might be able to. Please do give some feedback about tonight. I hope it's been useful. I'm sure you've all had a long day. So I hope it has been worth, you know, giving up part of your evening to come. If it hasn't, be honest in your feedback and tell us why. We're always looking to, you know, improve what we do. If you want to get in touch with me, as I say, there's the number for the confidential helpline. There's my email address. I am on Twitter, if anyone wants to follow me on Twitter. I think I've got about 6 followers now. I don't go on there very often, but you can find me. I think I'm GMC London, Sue at GMC London. So you can find me there as well. I hope tonight's been helpful. Does anyone want to make any last comment or any further questions before we bring things to a close?
Haytham,
Hello
Dr.
there.
Haytham.
Hi. Hi, Dr. Hytham. Did you want to ask a question or?
Hello.
Hello there.
Hi. Sorry. A quick question, actually. I'm working in one of the hospitals. We are it's what is a district general hospital.
كان حاجة أعمل
So
عن discussion أنا بس بدي أحضر
we,
ده كلام GMC ده حاوله
Sorry.
Sorry,
They're
if
on
anybody's
mute.
on mute here.
Yeah, sorry. Go ahead.
no worries. So I'm working in a district general hospital, and actually this case happened to one of my friends. So we used to contact other hospitals like Oxford or other hospitals to have an opinion on a case where we don't have like the specialized subspecialty in surgery or so on. So in that case, we used to share the images through like professional platforms. But in one occasion, one of my colleagues was asked to share a CT scan through like social media to give an advice from to like there was I think there was some problem with the formal website, the professional website that we were using, and the patient was a trauma patient who came acutely unwell, and he wanted to discuss it with Oxford. And when he contacted the registrar at Oxford, that registrar, because due to the circumstances, the registrar asked him to send a video of the CT scan without including the patient name or date of birth or anything, and send it to him so that he can look into it and see if this patient needs to urgently transfer to Oxford or not. So I understand it's not acceptable, but it was also unusual situation where this patient was unwell and they wanted an advice from more specialized center, and it needed urgent advice. So what do you think about this?
Yeah, so I think there's a couple of things to say there. You know, as I said at the beginning, you know, the first opening part of good medical practice is make the care of your patient your first concern. So, you know, from how you've described it, I think, you know, you could quite, you know, you can stand up and justify the actions that you did because of the circumstances and it was necessary, and probably did make a real difference, you know, to that patient's outcome. You know, so it's about, you know, things aren't black and white with good medical practice, you know, but it's about using your professional judgment and, you know, thinking to yourself, if I had to stand up and justify that, you know, in future, would I be okay to do that? And from the circumstances that you've described, you know, absolutely, it sounds as if, you know, that was needed and warranted. I think where you just have to be careful is that doesn't become normalized, you know, that the registrar is, oh yeah, you know, it's not something that's urgent or life-threatening. Oh yeah, you know, send me a video of it. That's when you just need to be mindful that actually, you know, when you've got time on your side, you know, to use the more the safer methods, I suppose, of, you know, NHS Net or you know, perhaps even using your IT team. You know, there's probably ways that you can upload and delete videos, etc. So yeah, does that helpful? Is that helpful? Oh, that's
Yeah, thank you so much. Thank you. Yeah, that
right.
was it.
So yeah, I mean, you know, as I say, things aren't black and white. And I think, you know, the NHS thing there, forgive me, I don't know if you were saying if it was instant messaging, but you know, something like WhatsApp, but you know, it's about a proportionate approach to it. So yeah, I think, yeah, I think that's that, you know, as I say, you know, you can justify the reasons that was done in that circumstance. And Okay, all right. Well, look, feel free to drop me an email if anyone's got anything they want to ask. I will ask the question actually about personal phones, because I've it's something I think we all do, don't we? Without perhaps thinking, what it is. I suppose if you are using a personal phone, there might be a risk that you could be sharing a I don't know, your new puppy photo or something with someone, so that could that might be a challenge. But I will ask my colleagues if there's any answers on that. So yeah, let's bring it to a close. Thank you very much. Thank you to Reem and Fatima for their help in pulling together tonight. Thank you.
Thank you. So if you have a few more minutes.
Yeah, sure.
I realize that we've gone over an hour, but it's quite an interesting subject, I think.
Yeah.
I think what I wanted to ask about was actually sort of doctors-only WhatsApp groups.
Yes.
You could still have quite heated discussions and disagreements there. I don't know if the GMC have got any sort of guidance on that, or where you
Yeah.
stand.
I mean, we say, you should treat your colleagues with respect and courtesy. And, that's not just because it's nice to do, it's because there's there's a big patient safety part that goes with that. You may know that we've got the new version of Good Medical Practice, which has been published and comes into effect in January. And this puts even more emphasis on behaviours, because what happens, the example, I think I spoke about this at the annual conference, but when someone is rude or disrespectful, whether we realize it or not, it does affect our performance. It preoccupies our thought, it lowers our goodwill, it damages our confidence as well. And we all perform better when we're feeling confident and supported, don't we? But the risk with medicine is that preoccupation affects your concentration, and then patient errors can happen. So there is something, it is important to be respectful and courteous to people online. That's not to say that we don't sometimes, need to kind of feedback to colleagues if there is something, but my advice would be, take it off of the WhatsApp group, pick up the phone, speak to people. I think it's I think we are at risk of losing the power of that, because it's so much easier just to sort of put our thoughts, isn't it, on paper, and not on paper, on text to each other. I think I would also so there is something about respect being a patient safety issue, as well as it just making for a nicer environment. So the Good Medical Practice is clear on that we should be respectful and courteous to colleagues. We should be aware of our own bias that we might have. And I'm just doing some work on Good Medical Practice at the moment, and about how it's it's not necessarily something that if you didn't do, you would come to the attention of the GMC, but we are really trying to get doctors to think about those colleagues who might need that bit more support. We talk all the time, don't we, about tackling discrimination, etc., but actually those protective processes of making people feel welcomed and belonged are those are what can really mitigate some of the need to tackle some of that. So I hope that helps. But yeah, and of course, although we might feel that it's just between doctors, there is always the risk that as some of the examples have shown tonight, it's quite easy to Snapchat it, and it's if you wouldn't speak to colleagues like that face to face, I would suggest changing your tone in how you communicate online.
Thank you very much, Sue. This is Fatima. I know we've kept you, sorry. I
All
just
right.
have one, two questions, one in the same context that you've just discussed. What I wanted to ask is if like two people, just specifically two people in a group of doctors, has sort of had these heated discussions about a personal issue, so not related to sort of politics, not related to race, religion, anything. It's something personal. If this was reported to the GMC, would the GMC act on it? If it's something, yeah, they've been disrespectful to one another, but it's not really related to patient's care or any sort of moral values that, like race and other issues that are sort of a problem to discuss, gender and all that.
So sorry, it is to do with race and gender, or
No, it's
or
not. It's not related at all. It's a personal problem between two people. They got a bit heated up in a group, in a doctors only group. What would be the GMC's thoughts on that?
I mean, when we have a referral come to us, we take into account, the context, the impact, the risk, to patients. So it's, those are the kind of things that we'll be looking at. I mean, it might be something that, we might not necessarily open an investigation into it, but we might just write to the doctor and just say, look, here's a reminder of what, of what good medical practice says about how to treat colleagues. And I think sometimes it's more that kind of exchange might become something that people kind of draw on when they're referring someone about, something else, if something else has kind of come to light. So it's difficult to say, it's not cut and dried that we would open an investigation on that. But those are the things that we would take into account, is the impact, the severity, the context. If someone was being really, very very rude, etc., and colleagues had seen that, then I think that makes a bigger case that a doctor is not demonstrating respect for colleagues. But I think even in a one-to-one, it's the same as, if a doctor spoke to you rudely, you would, it might warrant enough for you to feel okay, I want to refer that matter to the GMC. We do say, if you do, wish to refer another doctor to us, you should speak to a colleague first. So that's something to think about. But you are welcome as well to call to call our confidential helpline if you want, to get into more of the specifics for that case. So I mean, we do have thresholds for when we kind of open an investigation, but we do also close some cases where we just think, okay, this isn't enough gravitas for us to open an investigation, but we will send a letter to the doctor. So yeah.
Thank you. That's very helpful. I agree. I guess, yes. Maybe that person also, or these people, need help of some sort or some support. Maybe they're passing through a lot of social issues, maybe. And yeah, so I agree. Sorry, my last thing is, which is something you probably did answer, giving all these examples and with everything you've said, what is the GMC sort of expectation from medical associations, very much like ourselves? People who have like social media, we mainly sort of communicate through social media generally. This is how our association sort of reaches our members and followers. What is your expectations of us?
Again, I think, it's the standards that we expect of doctors, in their everyday working lives, respect, evidence-based, and yeah, having the correct professional tone in your actions and behaviors, because it's not just about your organization. When you go into the public forum, you are representing the profession. So again, when I talked at the beginning, it's, are your actions instilling those that make people trust you as an individual, and maintain that trust in the profession as well. So yeah, I hope that's helpful.
Yes, definitely. Thank you very much. And if sort of as an association, we feel that, for example, we've got a specific social media platform that we felt does not meet the sort of GMC recommendations, etc., what would you sort of advise us to do?
Yeah, I mean, it might be something to have a kind of in-house, internal kind of code of conduct. If you feel that, if you do feel that, conversations are not always kind of staying in a professional position, a professional tone, then it might be something to think about having an internal policy about how members use social media, communicate on social media. That might be something. But again, I think you mentioned people might have various stresses, etc. Going on, and I do think having. I think when I was speaking at your conference, I was talking about some of the tools you can use, because I think sometimes people don't realise the impact that their behaviours are having on other people. And when we do the professional behaviours, I don't know if you remember, but I talked about the you, I, we model. So just being quite neutral in pointing out, when we were talking about this the other night, I did notice, that you're it became quite agitated, and you did write this or you did say this to someone on the video call or whatever. So be quite neutral about it. And then we can't argue with people's feelings. If that if what someone has said has upset you or made you feel undermined or targeted, or all of those things, it's really hard to argue with how someone's actions have made you feel. And then the we part is what to do about it in future, and to just kind of do that. But I mean, if there is, if members are perhaps not abiding by the kind of tone, etc., that you would wish, then I think your kind of policy on the expectations that you have, and if people don't meet those, you could I mean, you could put come out of the digital world and put pen to paper and write to members and just kind of point that out. And I think sometimes that is often often enough to kind of make people change their behaviors and adapt.
All right, thank you very much, Sue. That was very, very helpful.
So, all right, well, listen, I'm here. If you've got any more questions, do drop me a line, or if you want to continue the conversation offline at some point, I'm happy to keep doing that. And yeah, keep up the great work. It was I really enjoyed coming to your conference. It was those doctors that I met were real joy to engage with and speak to. And you're a fantastic network and resilience for doctors. So do keep up the great work.
Thank you so much. So it's always a pleasure to have you. And thank you for all the participants. It's been quite a useful talk and very good discussions tonight. If there are no further questions, we can sort of end here, and this will be recorded. So if anybody wants to watch it again or have any further queries, feel free to email us at sgda@sgda.uk, or you can email Sue directly. And yeah, the link for the survey is in the chat if anyone wants to fill that in and get a certificate for tonight. Thank you, Sue.
All right, pleasure. Thanks, everyone.
Thank you. Bye-bye.
Thank you.
Bye.